So, very good morning. Is it audible to everyone? Good. You can hear me? Good. So, first of all the best for your FMGE exams. Try to stay calm in the exam. Don't panic. है ही नहीं हमारे पास खोने के लिए. सिंपल सी बात है बस. जो भी यहाँ से मिलेगा तो फिर ए पे जोड़ के जाएंगे ना, बस सिंपल सी बात है. So there is nothing to lose, first of all. So don't panic. We'll be discussing all the important medicine, what is this, community medicine MCQs for FMGE exams. Slightly the exams are getting tougher. So even FMGE exams, last time when I checked the paper, last 2-3 years, they're asking questions which are at NEET level also. So they want you to know more. They want you to work hard. They want you to compete. That is what their motto is. So if they expect something more from your side, you should also be ready to face the challenge, right? Good. So expectation किससे होता है? अगर कुछ कर सकते हैं ना, उसी से हम लोग एक्सपेक्टेशन रखते हैं. बस सिंपल सी बात है. अगर उससे नहीं होता तो फिर उतना लेवल तक एक्सपेक्टेशन नहीं रखते हम लोग. अगर एक्सपेक्टेशन है एग्जामिनर का तो फिर आपको भी वो एक्सपेक्टेशन मैच होना चाहिए. Got my point? Good. So we'll be discussing all the important questions. So the question was, identify the image representing National Leprosy Eradication Program. So 4 images are given. Identify the image representing National Leprosy Eradication Program. So what is the answer for this question? Good. Can see there. Can see the person handling the, or there is one thing like they're catching lotus in their hand and there is one sun inside this. So this is the logo for leprosy eradication program. Why they are keeping lotus? क्या reason है? मतलब there is nothing to do with BJP government. BJP government ने लॉन्च किया था ये वाला प्रोग्राम, अटल बिहारी वाजपेयी ने फंडिंग किया था. ये सब आप वाइवा में बोलते रहते हो ना, वो गलत है. सो लोटस का मतलब वो एक फ्लावर है जो कीचड़ से भी निकल के आ सकता है. इट कैन कम आउट ऑफ मार्श, डिचेस, डर्टी प्लेसेस. लेप्रोसी पेशेंट्स शुड नॉट बी स्टिग्मेटाइज्ड. डिस्क्रिमिनेशन, स्टिग्मा ये सब ज़्यादा होता है ना लेप्रोसी में. उनको देख के फिर विल बी फीलिंग देम लाइक दे आर अनटचेबल्स. ये सब सोसाइटी should not do all these things. That is why we are keeping lotus. No stigma, no discrimination. This is the symbol. This is the flower representing no stigma, no discrimination. Good. What is this? Logo 1. Can see something like crop, food related, na? Can see the crop, rice, wheat, whatever, green color. So it is related to food. Food related के लिए क्या nutrition scheme है? What is that mission called as? नेशनल लेवल में चलता है ना, नेशनल न्यूट्रिशन मिशन. उसको हम लोग क्या बोलते हैं? पोषण अभियान. गुड. पोषण प्राइम मिनिस्टर्स ओवरआर्चिंग स्कीम फॉर होलिस्टिक न्यूट्रिशन. रिपीट द फुल फॉर्म. वेरी गुड. प्रधानमंत्री ओवरआर्चिंग स्कीम फॉर होलिस्टिक न्यूट्रिशन. ये जो नेशनल न्यूट्रिशन मिशन है, it is also called as Poshan Abhiyan. This is the logo for Poshan Abhiyan. Good. What is this logo related to? Mother, father, एक छोटा सा बच्ची होगी ना, ऊपर सूरज, sun. Good. What is this logo related to? Don't write family planning program. It is NRHM, National Rural Health Mission. National Rural Health Mission का logo है. What is this logo related to? प्रधानमंत्री जन आरोग्य योजना. वेरी गुड. प्रधानमंत्री जन आरोग्य योजना. इट इज ए कंपोनेंट ऑफ व्हाट? आयुष्मान भारत. यस. जो आयुष्मान भारत स्कीम है ना, उसका 2 कंपोनेंट है. वन इज एस्टैब्लिशिंग हेल्थ एंड वेलनेस सेंटर्स. जितने भी पेरिफेरी में हेल्थ सेंटर्स होगा ना, उसको हम लोग कन्वर्ट कर लेते हैं हेल्थ एंड वेलनेस सेंटर्स पे. इट्स नॉट जस्ट हेल्थ, इट इज हेल्थ एंड वेलनेस सेंटर. गुड. सेकेंड थिंग इन आयुष्मान भारत scheme is this Pradhan Mantri Jan Arogya Yojana. So what you'll be doing in this? Health insurance, very good. कितने तक मिलेगा health insurance? What is the upper limit I'm asking? अप टू 5 लाख लिमिट है. एक फैमिली के लिए कितना इंश्योरेंस मिलता है? अप टू 5 लाख पर फैमिली पर ईयर. हर एक साल 5 लाख का इंश्योरेंस है. अप टू 5 लाख एम टेलिंग. दिस इज वेरी गुड स्कीम बाय इंडियन गवर्नमेंट. आयुष्मान भारत स्कीम के अंदर प्रधानमंत्री जन आरोग्य योजना. अगर हेल्थ इंश्योरेंस मिल गया ना तो एक सिक्योरिटी है फैमिली के लिए. इट इज इररेस्पेक्टिव, वेरी गुड, इररेस्पेक्टिव ऑफ फैमिली साइज. Not 5 members, not 10 members, it is irrespective of family size. Sir, age का फर्क पड़ेगा? No. Any aged individual in the family is eligible for insurance. Very good. कौन सा स्कीम है? What is this scheme called as? Tell me. Very good. प्रधानमंत्री जन आरोग्य योजना. Now the question is, लेप्रोसी का लोगो क्या होता है? Answer is option B. What is calculated with the available information? ये जो इमेज देंगे आपको, then they will ask what is this, whether it is maternal mortality rate or maternal mortality ratio. दोनों में फर्क पता होना चाहिए आपको. Tell me. Good. You have discussed this in the classes also. What is this? Very good. ऊपर maternal death हो गया, means how many mothers are dying. जितने भी obstetric causes हैं, मैनेजमेंट की टाइम पे अगर सिजेरियन सेक्शन का कॉम्प्लिकेशन हो गया, ब्लड ट्रांसफ्यूजन रिएक्शन हो जाता है, तो फिर एवरीथिंग इज काउंटेड. ड्यू टू ऑब्स्टेट्रिक कॉजेस, यस, न्यूमरेटर इज मैटरनल डेथ. एक्सीडेंटल कॉजेस वी डोंट काउंट. सुसाइड, होमिसाइड, व्हाट इज दैट, इलेक्ट्रिक शॉक, रोड ट्रैफिक एक्सीडेंट, disaster, bomb blast, all this will not be counted in the numerator. Numerator is maternal deaths due to obstetric causes and its related management. Yes, good. Denominator is women in the reproductive age. अगर दोनों same entities को compare करोगे ना, numerator mother, denominator is women in the reproductive age, वो ratio नहीं हो सकता है. Good. It has to be rate. Rate is comparison between two same entities. No sir, अगर डिनोमिनेटर चेंज करो, ठीक है चेंज करेंगे. देखो सुनो, लिसन, यहाँ पे डिनोमिनेटर अलग हो गया. लाइव बर्थ्स मतलब ऊपर मदर, नीचे छोटे छोटे बच्चे होंगे. लाइव बर्थ्स अगर डिनोमिनेटर में रखेंगे ना, दैट विल बिकम रेशियो. वेरी गुड. व्हाट इज द डिनोमिनेटर ऑफ मैटरनल मोर्टेलिटी रेशियो? टेल मी. गुड. What is the denominator of maternal mortality ratio? Anji sir, yes, denominator will be live birth. What is the answer for this question? Maternal mortality rate. Good. ये वाला क्वेश्चन देखो. We have mother, we have child. छोटा सा बच्चा है, तो फिर आप क्या मार्क करोगे इसको? गुड. So जननी शिशु सुरक्षा कार्यक्रम, option C is the answer. So option A is wrong because in the exams they gave option A, but that is totally wrong. It is option C. Janani Shishu Suraksha Karyakram. Don't mark Janani Shishu Swasthya Karyakram. So when I checked, most of the students they marked this answer. That is why I am putting this and I am telling this is wrong. Option A गलत है. What is the answer? Janani Shishu Suraksha Karyakram. So what is the advantage of जननी शिशु सुरक्षा कार्यक्रम? टेल मी. जेएसएस के प्रोग्राम का क्या एडवांटेज है? फ्री सर्विसेज मिलेगा. किस किस को मिलेगा फ्री सर्विसेज? यस, प्रेग्नेंट एंड सिक इन्फेंट दोनों को मिलता है फ्री सर्विसेज. व्हाट आर द फ्री सर्विसेज दे गिव? मेनली डाइट, ड्रग्स, डायग्नोस्टिक्स, बट ऑलवेज दे आस्क ट्रांसपोर्ट फैसिलिटी. ट्रांसपोर्ट फैसिलिटी, यस, transport facility. So this scheme is called as Janani Shishu Suraksha Karyakram. So what is the answer? What is the answer for this question? Tell me. Option C is correct. Don't mark option A. Option A galat hai. Option C is the answer. Janani Shishu Suraksha Karyakram. Very good. Come to the next question. What is the communication barrier if the interpretation of words are understood in a different manner? Yes, good. मतलब patient is understanding what you are telling in a different way. This barrier, communication barrier है ना, we call it separately. We give a different name for this. What is the name given? This was the question. Yes, good. You are telling patient take tablets twice a day. Yes, take tablets twice a day. But patient क्या करेगा? हर एक वक्त दो दो टैबलेट ले रहा है. गलत है ना? You are telling take tablets twice a day. मतलब सुबह शाम बस. But the patient is interpreting the things in his different way. Take tablets twice a day मतलब he is taking take 2 tablets करके समझ गया वो. मतलब ब्रेकफास्ट के बाद 2 टैबलेट, लंच के बाद 2 टैबलेट, फिर रात को 2 टैबलेट. 6 टैबलेट खत्म हो गया. फिर आप तो 3 दिन के लिए दिया था, फिर वो 1 दिन में आ जाता है आपके पास. सर जी टैबलेट खत्म हो गया. कि क्यों भाई, मैं तो बताया था फिर आपको सुबह शाम लेने के लिए. नहीं सर, टेक टैबलेट्स ट्वाइस अ डे लिखा था, मैं तो 2 टैबलेट ले रहा हूँ. व्हाट इज दिस कम्युनिकेशन बैरियर कॉल्ड एज सेमांटिक बैरियर. डोंट से समानता को देख के फिर सर घूम जाता है. सेमांटिक बैरियर नहीं होता ये. व्हाट इज दिस semantic barrier, misinterpretation of meaning, not able to understand and understanding in a different way. That is semantic barrier. What is language barrier? तो लैंग्वेज समझ नहीं आ रहा है फिर. दैट इज सिंपल सी बात है. सो यू आर टेलिंग इन हिंदी, patient does not know Hindi, patient knows only Tamil. Example I'm telling, you are telling in Tamil, patient does not know Tamil, patient know only Hindi. This language का barrier तो होता ही होता है हर जगह. That is why language is very very important. You should communicate in the language the patient will understand. The word language, if it is coming, then it is linguistic barrier. So don't mark linguistic for this. It is semantic barrier. Psychological barrier क्या होता है सर? सुनो, हर एक बंदे का मूड अलग अलग होगा. Confidently I can tell mood will be different. Now the patient is totally emotionally gone. But that time if you're telling something, emotional disturbance, this word should be there. Repeat. Emotional disturbance. अगर ये word है option questions के अंदर, then you have to mark psychological barrier. Write that keyword. Exam is nothing but playing with keywords. यहाँ पे क्या keyword है? Misinterpretation. ये जो word आते ही फिर answer I told I have to mark semantic barrier. Emotional disturbance, psychological barrier. Cultural barrier का एक question है, सुनो listen. You are going and giving oral polio vaccine, mop-up you are doing, like pulse polio immunization you are doing. Certain people, certain community, they are not accepting oral polio vaccine because of their beliefs. This question will come. Belief का word आते your answer should be culture. उनका एक सोच है, बहुत साल से चल के आया होगा ना. That belief is there. That oral polio vaccine is not beneficial. Something will happen. That beliefs, if it is present, it's very very difficult to communicate to them. That barrier which comes, that beliefs in between it is coming, that is a barrier. We are not able to reach that community. That is called as cultural barrier. Repeat the words. What is that barrier called as? Cultural barrier. So what is your answer, beta? Good. Yes, option B, semantic barrier. Very good. Yes. Come to the next question. हर एक एग्जाम में ये वाला क्वेश्चन तो होना ही होना, इसके बिना तो एग्जाम होगा ही नहीं शायद. यस गुड. तो पहले एग्जाम में डिसाइड कर लेते हैं, ये वाला क्वेश्चन डाला है कि नहीं आपने? हाँ जी सर डाल दिया, तो दे दो पेपर. नहीं सर नहीं डाला, फिर यार डाल दे भाई. यस गुड. 30 young volunteers with previous lifestyle modification, yes, were contributing to drug trial for cholesterol levels based on statin therapy. Listen, one group you are taking, they had lifestyle modifications before, but now you are taking them into drug trial, checking whether statins will make a difference on their cholesterol levels or not. Sir, what is the keyword? Hanji, cholesterol levels is the keyword. Highlight this word. Quantitative data. Very good. Repeat the words. Quantitative data, cholesterol levels. फिर कैसे समराइज करोगे क्वांटिटेटिव डाटा को? मीन में समराइज करते हैं हम लोग. व्हाट इज दिस? मीन हाइट, मीन वेट, मीन कोलेस्ट्रॉल लेवल, मीन hemoglobin level. Like that we summarize quantitative data. When you have mean, one group you are taking. How many groups you are taking? One group you are taking. Before intervention, after intervention, yes. How many months of statin therapy? 9 months. पहले कितना था कोलेस्ट्रॉल लेवल, फॉर एग्जाम्पल आई एम टेलिंग 180, अब कितना हो गया 150, जो फर्क आ गया ना, थोड़ा सा कम हो गया ना, दैट फर्क, द डिफरेंस इज बिकॉज ऑफ द इंटरवेंशन व्हाट यू आर डूइंग, यस और नो, हु विल डिसाइड दिस, देयर इज ए टेस्ट, हर एक चीज के लिए एक प्रोसीजर होता है, अपने हिसाब से हाँ बढ़िया बेटा वैसे नहीं बोलेंगे हम लोग, कुछ ना कुछ क्राइटेरिया रखते हैं, स्टैटिस्टिकल सिग्निफिकेंस प्रूव होना चाहिए, पेशेंट थोड़ा सा क्लिनिकली इंप्रूव हो जाता है वो अलग बात है, लेकिन स्टैटिस्टिकल सिग्निफिकेंस होना जरूरी है, वेरी वेरी इंपॉर्टेंट, दिस इज वेरी वेरी इंपॉर्टेंट, हु विल प्रूव दैट स्टैटिस्टिकल सिग्निफिकेंस, यस सर वी हैव वन टेस्ट, पेड टी टेस्ट के ऊपर क्लिक करो, सॉफ्टवेयर में वैल्यूज डालो, ग्रुप 1 बिफोर आफ्टर, बिकॉज एक ही ग्रुप लेके चलोगे ना, तो दो एक्सेल वैल्यूज आपको डालना होता है, फिर सॉफ्टवेयर में जाना है तो सॉफ्टवेयर विल आस्क व्हाट टेस्ट यू वांट मी टू पुट, तो आपको पता होना चाहिए कौन सी टेस्ट यूज करना है, यू शुड नो व्हाट टेस्ट हैज टू बी यूज्ड, you should know what test has to be used, then click on that test. What is that test which I am clicking there? Paired t-test will decide the statistical significance. क्वेश्चन को अगर चेंज करेंगे हम लोग, सुनो लिसन, क्वेश्चन को चेंज करेंगे, ग्रुप 1 was given statin, ग्रुप 2 was given something else, सो स्टैटिन ए स्टैटिन बी, दो स्टैटिन लेके चलोगे, एटारोस्टैटिन वोरवोस्टैटिन, टू अलग अलग ड्रग, एग्जाम्पल हम पहले, सो ग्रुप 1 को ये वाला ड्रग दिया आपने, ग्रुप 2 को ये वाला ड्रग, मतलब एक ग्रुप के बीच में नहीं, बिफोर आफ्टर, ये दो ग्रुप के बीच में, तो एक ग्रुप लेके चलोगे तो पेड टी टेस्ट हो गया, अब स्टडी दो ग्रुप में चलेगा, ग्रुप 1 को वन ड्रग, ग्रुप 2 को और एक ड्रग, फिर आगे जाके ग्रुप 1 और ग्रुप 2 में क्या फर्क है, ये वाला ट्रीटमेंट अच्छा है या दूसरा ट्रीटमेंट अच्छा है, वैसे कंपेयर करोगे ना, मीन बिटवीन टू ग्रुप्स, व्हाट टेस्ट, आंसर इज अनपेड टी टेस्ट, अगर दो ग्रुप लेके चलेंगे, अगर क्वेश्चन वैसे हो गया तो फिर आंसर इज अनपेड टी टेस्ट, also called as what test, unpaired t test is also called as what test, repeat, student t test, yes good, if they ask between two groups mean, your answers should be student t test, also called as unpaired, unpaired क्यों बोलते हैं हम लोग उसको, दो अलग अलग ग्रुप है ना, इसलिए we call it as unpaired t test. This question is on paired t test. See the next question, very very important. A case control study is conducted on the association between intake of vitamin C and occurrence of respiratory illness. So कौन सा स्टडी कंडक्ट हुआ था, केस कंट्रोल स्टडी, केस कंट्रोल स्टडी में क्या करते हैं हम लोग, अगर पूछेंगे तो आंसर शुड बी एसोसिएशन, गुड, फिर से रिपीट करो, केस कंट्रोल स्टडी में क्या स्टडी करेंगे हम लोग, कोरिलेशन, रिस्क रेशियो, एसोसिएशन, अगर वैसे वर्ड आ गया तो आंसर शुड बी association between what, exposure and outcome, repeat, what is exposure, vitamin C, what is outcome, respiratory illness, what is the correct order in which the steps of case control should be conducted, yes, three words, how we study in the class, repeat, three words, case, जिसको ऑलरेडी है डिसीज तो पहले उसको सेलेक्ट करेंगे, those who are having an attack of respiratory illness they will become case, तो फिर उनको एक जगह लाओ, जितने भी केसेस होगा आपके पास 20 केसेस है, और हैविंग सोर थ्रोट फॉर एग्जांपल, और रेस्पिरेटरी इलनेस, स्लाइट शॉर्टनेस ऑफ ब्रेथ एग्जांपल, 10 केसेस सेलेक्ट करोगे, यस, स्टडी तो कंट्रोल लेके चलना होता है, फिर कंपैरिजन, इट इज कंट्रोल, यस, healthy individual, repeat, healthy individuals, how case control study starts, tell me good, yes sir, पहले cases लेंगे फिर बाद में controls, means deceased versus non-deceased, if they ask case control study how it starts, deceased versus non-deceased, very very important step is matching, shadi.com, yes good, same age, same sex, same occupation. Usually occupation can be a risk factor for respiratory illness, age and sex at times, सब मैच करो, अगर केस 29-year-old मेल है, टीचर है, 29-year-old मेल टीचर, कंट्रोल को भी वैसे ही लेना होगा आपको, 29-year-old male teacher. Yes, good. Same to same factors you are matching. What are the factors you are matching? Repeat 3 words. Age, sex, occupation. 3 factors match करके controls को select करना होगा. Repeat. What is this procedure of selecting controls? Similar to cases with respect to age, sex, occupation. These factors को अगर match करोगे उसको क्या बोलेंगे हम लोग? Matching. Yes, good. So tell me 3 things in sequence. Repeat the words. पहले case लेंगे. Yes, very good. फिर controls. Yes. When you select controls, you have to do matching properly. Later is very, very important. You ask exposure in cases and controls. How many are having vitamin C or something in their diet? You should ask the history. What is your diet? How many, like, would you have carrots, lemon, guava, all citrus fruits, for example? Cases में study करो. Out of 10 cases, like 8, example I'm telling, out of 10 cases, 8 are exposed to vitamin C. But out of 10 controls, all are exposed to vitamin C. All are exposed to vitamin C, so they are healthy. That is why exposure is more in controls now compared to cases. So it is a protective factor, like that you have to prove. If it is more in cases, it will become risk factor. If it is more in controls, it will become protective factor. Yes. 4 steps, tell me in sequence. Case, control, matching and exposure. After exposure assessment, स्टडी को खत्म करना होगा. जैसे स्टडी स्टार्ट हुआ था, स्टडी को फिनिशिंग टच भी देना होता है ना. मैच खत्म करके आओगे तभी तो बात है. तो बीच में छोड़ के फिर कि नहीं कोई और मैच खत्म करेगा, नहीं. अपने हाथ में सब कुछ है. यू हैव टू स्टार्ट द मैच, यू हैव टू फिनिश द मैच. बीच में यू हैव टू सर्वाइव. सर्वाइवल इज वेरी वेरी इंपॉर्टेंट. सो स्टार्टिंग एंडिंग तो चलेगा ही चलेगा, बीच में सर्वाइवल इज ऑल्सो वेरी इंपॉर्टेंट. रिपीट, टेल मी 5 स्टेप्स. केस, control, matching, exposure. What is number 5? Analysis. Very good. What is analysis का मतलब? Odds ratio calculation. Very good. What ratio we calculate in case control study? Tell me, repeat with me. Good. What ratio we calculate in case control study? Odds ratio. Odds ratio assessment is done in case control. Yes. So पहले step case and control, then comes matching, then comes exposure, then comes analysis. Okay, option A is the answer. This was the correct sequence. So if they ask case control study like this, you have to tell like 5 things together. Tell me मतलब case, control, matching, exposure, odds ratio, analysis. Good. Come to the next question. Very good. Come to the next question. Question is telling birth rate and death rate is changing with respect to time. Repeat, what is the cycle called as? Demographic cycle. ये जो cycle है ना, this is called as demographic cycle. What is happening in demographic cycle? Birth rate and death rate is changing with respect to time. तो x axis में क्या रहेगा? Time. जैसे टाइम होता जाएगा सब कुछ चेंज होता रहता है, वैसे बर्थ एंड डेथ रेट भी चेंज होना चाहिए. तो टाइम इज एवरीथिंग. गुड. जो आपका अभी का जो फेज है ना, वो आगे कुछ और हो सकता है, इसलिए डोंट वरी. एवरीवन इज हैविंग देयर ओन टाइम. अपना टाइम अपन खुद लाएंगे, फिर आगे भी आएगा, टाइम चलता रहेगा. सो टाइम के साथ साथ हम लोग म्यूटेट होना चाहिए. वी हैव टू गेट स्ट्रॉन्गर. स्पेशली मेंटल हेल्थ इज वेरी इंपॉर्टेंट. मेंटली वी हैव टू बिकम स्ट्रॉन्गर. Physically, yes, with age, everything will change. Physiological variables will change. But with age, mentally, you have to become tough. Repeat. What is x-axis in demographic cycle? Time. What is y-axis? Birth rate, death rate change होगा. That is what you are showing. The question is, what is this line? ये जो red color का line है ना, what is this line? कैसे पता करेंगे हम लोग इसको? Birth rate या death rate? Sir, color तो दिया होगा ना उधर ही. ग्रीन रेड, वो तो ठीक है, समझ आ गया. वेरी गुड कॉमन सेंस. रेड का मतलब मर जाता है, तो फिर डेथ रेट ही लिखना चाहिए. ठीक है. अगर कलर सेम है सबका तो फिर क्या करोगे? यहाँ पे देखो, स्टेज 1 में दोनों सेम है, बराबर है. स्टेज 2 में देखो व्हाट इज कमिंग डाउन, वहां पे क्लू है आपका बस. हाँ, वहीं पे आंसर निकल जाना चाहिए, आगे तक नहीं जाना चाहिए, यहीं पे आंसर मिलना चाहिए. जैसे health facilities will improve, hospitals diagnostic facilities will improve, infections के लिए antibiotics आ जाएगा, तो फिर death में असर पड़ेगा ना. पहले what will come down? Common sense. What will reduce first? See there. Death rate will come down first. So line B represents death rate. यहाँ पे देखो बर्थ में असर अब नहीं, बाद में आएगा. स्टेज 3 में आना शुरू हो जाता है बर्थ रेट में असर. बर्थ रेट विल स्टार्ट डिक्लाइनिंग इन स्टेज 3. डेथ रेट विल स्टार्ट डिक्लाइनिंग इन स्टेज 2. रिपीट, डेथ रेट विल स्टार्ट डिक्लाइनिंग इन स्टेज 2. बर्थ रेट विल स्टार्ट डिक्लाइनिंग इन स्टेज 3. क्या रीजन है बर्थ कम होने का? मतलब फैमिली प्लानिंग अवेयरनेस इज वेरी वेरी इंपॉर्टेंट. फैमिली प्लानिंग प्रोग्राम, birth rate will come down. So what is this? Line B represents what? Decrease in death rate. Yes, good. A is birth rate, B is death rate. A is birth rate, B is death rate. Come to the next question. In a sudden onset disaster, the recovery phase consists of which of the following? What they are telling is recovery phase means after disaster. The question is not before disaster. Repeat two words. Question is after disaster. So once disaster happens, yes, good, repeat. After a disaster, three things should happen. One is response, rehab, reconstruction. Tell me 3 R's with me. Very good. Tell me 3 R's with me. Yes, repeat 3 R's. Response, rehab, reconstruction. Very good. What is response means? Good. सर कुछ हो जाता है, मतलब फ्लड हो गया, अर्थक्वेक हो गया, उसमें रेस्पॉन्स क्या आता है? टेल मी व्हाट इज रेस्पॉन्स इन दिस. गुड. ट्राइएज. यस, स्टार्टिंग थिंग. इफ यू आर डूइंग समथिंग कॉल्ड एज ट्राइएज, वो रेस्पॉन्स में आएगा. ट्राइएज में कितना कलर्स है बेटा? टेल मी. वेरी गुड. हाउ मेनी कलर्स आर देयर इन ट्राइएज? 4 कलर्स सर. यस. हाउ टू रिमेंबर सर? ट्रैफिक सिग्नल, रेड, येलो, ग्रीन, ब्लैक. रिपीट. ट्रैफिक तो वैसे चलता है ना, पहले रेड है, फिर बाद में येलो आएगा, फिर ग्रीन, देन ब्लैक. 4 कलर्स आर देयर. रेड, येलो, ग्रीन, ब्लैक. If there is tension pneumothorax, for example, tension pneumothorax, surgery has to be done within 6 hours. 6 hours के अंदर we have to do surgery. Good. That within 6, if you want to do surgery, life saving surgery has to be done. कौन सी कलर में जाएगा? 6 hours की बात चल रहा है. Yes, good. Red color. Surgery has to be done. Life saving skills, life saving procedures has to be done within 6 hours. Within 24 hours तक वेट कर सकते हैं हम लोग. Give yellow color. एम्बुलेटरी पेशेंट्स नॉर्मल है, ओपीडी बेस्ड है, कुछ हुआ नहीं है, थोड़ा सा एब्रेशन है, यहाँ पे थोड़ा सा कट है, चलेगा. दे विल बी अंडर ग्रीन. गुड. ब्लैक मीन्स ब्रेन डेड, नो यूज. उसको क्या बोलेंगे हम लोग? मॉरिबंड पेशेंट्स. सो हु इज गिवन लीस्ट प्रायोरिटी? नॉट ग्रीन, इट इज ब्लैक. हाइएस्ट प्रायोरिटी रेड, least priority black. So come to the next step is rehabilitation. पहले उस लेवल में ट्राइएज कर लो. अगर अर्थक्वेक हो जाता है तो फिर वेरी डिफिकल्ट. दे लूज देयर हाउसेस, they lose their houses. We have to rehabilitate them. Separate rehabilitation centers, temporary centers you have to establish. Then after rehabilitation phase comes reconstruction. वो जो सिटी बर्बाद हो चुका है ना, उसको कैसे हम लोग रिकंस्ट्रक्ट करेंगे? Yes, that will be there with the help of, like, government will take care all those things. So 3 R's, repeat with me. Very good. What are 3 R's? Response, rehab, reconstruction. Very good. These are the things which happen after disaster, that is recovery phase. So answer is response, rehab. So option C is the answer. Before disaster, what are the things we have to do? Very very important. Madhya Pradesh is the mnemonic. Repeat the mnemonic. MP, Madhya Pradesh. क्या करेंगे हम लोग? मध्य प्रदेश का मतलब मिटिगेशन. व्हाट इज इंग्लिश वर्ड? मिटिगेट. मिटिगेट मीन्स थोड़ा सा कम करेंगे रिस्क फैक्टर्स को ना. अगर earthquake बार बार होता रहेगा, if it is a seismic zone 4 for example, where earthquakes keep on happening, So before only, while giving permission to construct houses, we have to make rules and regulations. Earthquake proof buildings has to be constructed. देखो आप अगर घर अपने हिसाब से बिल्ड करोगे ना तो फायदा नहीं है, आगे कुछ हो जाता है तो फिर सब कुछ पानी मिट्टी जो भी है, मिट्टी में बोलो earthquake है ना, it will go into मिट्टी. That is why the rules should be there. Earthquake proof structures we have to build. जो earthquake proof structure ना वो किस में जाता है? Tell me good. Reducing the risk factors to prevent further damage. आगे कुछ हो जाएगा इसलिए पहले रेडी हो जाते हैं हम लोग. मिटिगेट इज द आंसर. मिटिगेट मीन्स रिड्यूसिंग द रिस्क फैक्टर्स टू अवॉइड फर्दर डैमेज. सर व्हाट इज प्रिपेयर्डनेस? हाँ जी, वेरी गुड. प्रिपेयर्डनेस मतलब सुनो, साइक्लोन ये वार्निंग है. आफ्टर 4 days in this locality coastal area you are saying there will be one cyclone, तूफान, tsunami. Example I'm telling. पहले ही वार्निंग मिल चुका है. फिर आपको उस टाइम पे मॉक ड्रिल्स अगर कंडक्ट करेंगे हम लोग, क्या करना चाहिए अगर कुछ यहाँ तक पानी आ गया तो फिर आपको क्या करना चाहिए, कहाँ भागना चाहिए, कहाँ एग्जिट है, कहाँ मतलब आपको किधर तक जाना होता है. फिर ये सब मॉक ड्रिल्स के थ्रू ही हम लोग वी कैन ट्रेन देम. गुड. सिमुलेशन बोलते हैं हम उसको इंग्लिश में. यस गुड. सिमुलेशन एक्सरसाइज. यस, मॉक ड्रिल भी इंग्लिश है, सिमुलेशन भी इंग्लिश है. इंग्लिश का यही दिक्कत है, बहुत सारा मीनिंग्स होता है इंग्लिश में. फिर आपको एमसीक्यू ये भी आ सकता है, वो भी आ सकता है. ये मॉक ड्रिल आए तो भी वही आंसर है, सिमुलेशन एक्सरसाइज आए तो भी वही आंसर है. व्हाट इज द आंसर? प्रिपेयर्डनेस. डोंट मार्क मिटिगेशन फॉर मॉक ड्रिल्स. गॉट माय पॉइंट? रिपीट. 3 R's. टेल मी. वेरी गुड. Response, rehab, reconstruction. Good. Awesome. Chumma. Good. Come to the next thing. Before disaster, Madhya Pradesh, mitigation and preparedness. Come to the next question. Very very important question. ये क्वेश्चन के बिना भी एग्जाम नहीं होता है. गुड. एक तो पेयर टी टेस्ट आएगा, दूसरा स्ट्रैटिफाइड सैम्पलिंग आएगा आपको बार बार. क्यों सर? मतलब वही इंपॉर्टेंट है हमारे लिए स्टैट्स के अंदर. FMG एग्जाम्स, FMG स्टूडेंट्स दे आर clearing the exams, they should know 2 things. That is what our intention is. Simple as this. It's all about intent, what we want, whether you know or not. If you know what we want, दोनों match हो गया तो फिर clear. बल्ले बल्ले. Good. Yes, good. A pharmacist randomly select from 3 groups of medicine, plant-based, animal-derived and synthetics, like how they are responding. Sampling is being done. So what they are doing is 3 separate groups will make, homogeneous groups. फिर हर एक ग्रुप से अगर 10-10 इंडिविजुअल्स रैंडमली लिया आपने, या तो 10 इंडिविजुअल्स इधर से, 8 इंडिविजुअल्स और 4 इंडिविजुअल्स. सो रैंडमली इफ यू आर सेलेक्टिंग एंड चेकिंग देयर रेस्पॉन्स, how they are responding, this type of sampling is called as stratified random sampling. Good. What is the English word? Repeat with me. What is stratification means? What is stratification means? Grouping. How many groups you are making? 3 homogeneous groups. Within that, how many individuals you are selecting? Randomly. That is why it is called as stratified random sampling. Sir, simple random sampling का मतलब क्या होता है? Tell me. Simple random means groups नहीं करेंगे हम लोग. अगर 100 students are there in the class, 10 students are selected. That's it. Boys, girls करके divide नहीं किया हमने. अगर boys इधर आओ, girls इधर आ जाओ, फिर वैसे अगर सैम्पलिंग करोगे ना, दैट इज स्ट्रैटिफाइड रैंडम सैम्पलिंग. यहाँ पे बॉयज गर्ल्स करके डिवाइड नहीं हुआ था, एक ही ग्रुप में अगर सेलेक्ट किया तो दैट इज सिंपल रैंडम सैम्पलिंग. इफ द क्वेश्चन कम्स आउट ऑफ 100 स्टूडेंट्स, 10 students are selected randomly, lottery method if I am selecting, that is simple random. Systemic sampling क्या होता है सर? Systemic sampling में क्या वर्ड्स आएगा ना एग्जाम के अंदर, सुनो. Every 10th unit is selected, every 5th unit is selected, every 5th student is selected. These are the keywords I am telling. See, sampling पूरा डिटेल में डिस्कशन नहीं है यहाँ पे. PYQs कैसे क्रैक करना, that is the intent of this session. Every 10th unit, every 5th patient is selected. If that question comes, your answer will be systematic random sampling. Sir, what is cluster random sampling? Cluster में क्या है ना, इंडिविजुअल्स को रैंडमली नहीं उठाते हम लोग, यहाँ पे क्लस्टर्स को रैंडमली उठा देते हैं. लाइक फॉर एग्जांपल गौतम नगर एक लोकेलिटी हो गया, करोलबाग एक लोकेलिटी है, फिर एक मालवीय नगर एक लोकेलिटी है, फिर और एक लोकेलिटी द्वारका सेक्टर 22. जैसे बहुत सारे क्लस्टर्स है हमारे पास दिल्ली में ना. So out of 10 clusters, 2 clusters are selected. गौतम नगर को ले लो, करोल बाग को ले लो, रैंडमली आ जाता है, हमें नहीं पता कि क्या गुदार का भी आ सकता है, मालवीय नगर भी आ सकता है. आउट ऑफ 10 क्लस्टर्स इन द सिटी, 2 clusters are selected for the study. वहां पे जाओ, फिर पूरा एरिया स्टडी करो. उसके अंदर अगर इंडिविजुअल्स को भी रैंडमली उठाओगे आप, गौतम नगर में जाओ, फिर इधर सब लोग गौतम नगर वाले, यहाँ पे 100 बच्चों को हम उठा लेंगे, वैसे अगर रैंडमली उठाते होते हैं, दैट विल बिकम 2 स्टेज सैम्पलिंग. वहां पे रैंडमली नहीं उठाएंगे हम लोग, क्लस्टर्स को रैंडमली उठा देते हैं डायरेक्ट. क्लस्टर इज द फाइनल सैम्पलिंग यूनिट, नॉट इंडिविजुअल. व्हाट इज दिस सैम्पलिंग वेयर क्लस्टर्स आर रैंडमली सेलेक्टेड? Cluster random sampling. Next question. They will ask median calculation for you. Mean also can be asked. They're not asking, they're not testing your knowledge. यहाँ पे अगर कोई मीन मीडियन पूछेंगे ना, तो नॉलेज टेस्ट नहीं हो रहा है यहाँ पे, पेशेंस का टेस्ट होता है. बस सिंपल सी बात है, बंदे में है कि नहीं पेशेंस. वेट करना, वेट तो मीडियन के लिए कितना वेट करोगे, 10-15 सेकंड में आंसर आना चाहिए. फिर भी क्वेश्चन क्या है ना, सर्जरी का क्वेश्चन आया था, साइकियाट्री का क्वेश्चन आया था, साइकियाट्री का क्वेश्चन, फिर बायोकेमिस्ट्री का क्वेश्चन केम, देन दिस क्वेश्चन विल कम, दिस विल टेस्ट योर पेशेंस. मीडियन क्या होता है? व्हाट इज मीडियन? सेंट्रल वैल्यू ऑफ एन ऑर्डर्ड डाटा. 1 2 3 4 5. Easy question I'm asking. 1 2 3 4 5. Everyone knows what is median? 3. 1 2 3 4 5 6. What is median? 3 plus 4 by 2. Even set of values है 1 2 3 4 5 6. तो median will be the value or what is that? Average of the central two values. यहाँ भी वैसे ही करोगे. सुनो, listen. 2 3 4 4 5 6 7 8. Good. Order में होगा ना? Yes, good. It is there in the order? Yes. Easy question. अगर order में नहीं था, फिर पहले कॉपी करोगे, फिर ऑर्डर में लगाओगे, उसमें टाइम लग जाएगा. डोंट पैनिक, डोंट पैनिक, नथिंग टू लूज. कुछ है ही नहीं हमारे पास खोने के लिए, फिर है क्या मतलब? हाँ, वैसे जाओ. माइंडसेट इज वेरी वेरी इंपॉर्टेंट. FMGE एग्जाम भी क्लियर होना चाहिए, आगे नीट भी क्लियर हो जाएगा, क्योंकि खोने के लिए कुछ है नहीं हमारे पास. वी डोंट हैव एनीथिंग टू लूज, एवरीथिंग वी हैव टू लिव हियर ओनली. That is very important. Being free, flying free mindset is very very important. This mindset will come when you lose everything. No, because there was nothing to lose. हर एक फेज में कुछ ना कुछ खोते जाओगे. That is what life is. But still you have to stay, you have to play, you have to finish the match. Tell me, 2 3 4 4 5 6 7 8. What is median? ये दो वैल्यूज है ना, इसका एवरेज लेना चाहिए आपको. 4 plus 5 by 2. 9 by 2 कितना हो गया? 4.5. आंसर इज 4.5. मीडियन इज द एवरेज ऑफ द सेंट्रल टू वैल्यूज. अगर ये वाला नंबर नहीं था, 8 नंबर was not there, then it would have become easy for us. If I remove 8, then median will change, then median will become 4. But now if 8 is there, फिर उसको भी इंक्लूड करना होगा, इवन सेट ऑफ वैल्यूज, देन मीडियन इज 4.5. Identify the use of this image. So what image they have given for you? It is almost similar to this. Usually we keep black color here. यहाँ पे ना क्या थर्मोमीटर है? What is this thermometer? Tell me good. So जो इंस्ट्रूमेंट्स पढ़ाते हैं ना हम लोग क्लास में एनवायरनमेंट के अंदर, तो स्टार्टिंग वाला इंस्ट्रूमेंट यही होता है बार बार. सो इसके बिना तो एग्जाम slightly, usually examiner is fond of this image. Usually examiner is fond of this image. What is this image called as? Kata thermometer. Repeat the words with me. Yes, good. What is this image called as? Kata thermometer. Kata thermometer was used for cooling power. Answer is cooling power. पहले इसको किसके लिए यूज करते थे हम लोग? For what we used to have it before, not now. It was पहले, मतलब it was used for cooling power. Now it is used for what? Air velocity. अगर एयर वेलोसिटी भी ऑप्शन में था, तो फिर एयर वेलोसिटी भी आंसर हो सकता है. अब एयर वेलोसिटी नहीं दिया था, ठीक है, एग्जामिनर वाज वेरी गुड. दे डोंट वांट टू टॉर्चर यू, दे डोंट वांट टू मार्क समथिंग एल्स, दे वांट यू टू मार्क द आंसर. काटा थर्मोमीटर वाज यूज्ड फॉर व्हाट? आंसर इज कूलिंग पावर ऑफ द एयर. वेरी गुड. टेम्परेचर, एयर टेम्परेचर करके कुछ नहीं होता है. गुड. रेडिएंट हीट के लिए वी हैव ग्लोब थर्मोमीटर. ह्यूमिडिटी के लिए वी हैव, यस गुड, साइक्रोमीटर्स. रिपीट. रेडिएंट हीट, ग्लोब थर्मोमीटर. Humidity, we have Asman's psychrometer. Our next question, very, very important. Yes, the student was making one presentation with charts but lost the titles while editing. So मतलब इसमें क्या लिखना चाहिए ऊपर? What is the heading? This was the question. What should be the heading of the following chart? फिर आप क्या देखोगे इसमें? Good. Life expectancy at birth. Okay, good. ये देखते हैं, आपको आंसर मार्क कर लेना चाहिए था. ठीक है. Expected years of schooling, mean years of schooling. ये दोनों knowledge component है. K for knowledge. I for income. What we check in income? Gross national income. Repeat the words. It is not GDP. It is GNI. Gross national income per capita. So per capita gross national income. Yes, we consider. Along with this, we consider longevity. How many years they live from birth? Life expectancy. So three words are there. K for knowledge, I for income, L for longevity, life expectancy at birth. So knowledge, income, longevity, kill. So the answer is Human Development Index. What is the mnemonic for Human Development Index? Open your notes. Yes, it is kill. Knowledge, income, longevity. So what they will assess? Three dimensions they will assess. Knowledge, income, longevity. Within knowledge, what are the things they assess? Mean years of schooling and expected years of schooling, not literacy rate. Don't make mistake. यहाँ पे literacy rate consider नहीं करेंगे हम लोग. If they ask literacy rate is considered, no. Long back, पहले literacy rate consider करते थे, अब नहीं. Good. GDP, no. It is GNI. Life expectancy at age 1, no. Life expectancy at birth. Physical quality of life index, what is the difference? PQLI में क्या क्या होता है? Tell me. Very good. Income, no. PQLI, income is not considered. Income is not considered. What we consider in PQLI? Repeat three words. Infant mortality rate, literacy rate, and life expectancy from age 1. How to remember? IL is the mnemonic. IL. Infant mortality rate, literacy rate, life expectancy at age 1. So don't confuse between two things. Kill is different, ill is different. What is kill? HDI. What is ill? Infant mortality rate, literacy rate, and life expectancy from age 1. Good. A mother delivers a baby in rural area with the assistance of skilled birth attendant. Very good question. The attendant cuts the umbilical cord, clean it, ties the ends with new threads. Good. Bathes the baby with warm water. Okay. Wipes the baby's eyes with a sterile wet cloth from medial to lateral canthus. Good. Then the hands over the baby to the mother for skin to skin contact. Which of the following step is incorrect? Which should not be done? Tying the umbilical cord with clean threads, new threads, correct. Wiping the baby's eyes from medial to lateral canthus, correct. Skin to skin contact is very, very important. So warm chain they have to maintain for temperature. So you are making a mistake here. Immediate bathing is not advised. So sponging can be done after 24 hours. So we have to wait for 24 hours, not bathing. It is just sponging. Wet cloth, yes, warm, wet cloth, you can do sponging. Not bathing. Bathing, if they ask, sir, sponging, yes, after 24 hours. Every alternate day you can practice sponging. Every alternate day. But bathing, you have to wait until the umbilical cord falls off. Maybe 2 weeks it will take. So then the baby should be bathed. So bathing is important, very good cultural practice. Yes, where the baby, maybe when you are bathing the baby, the whole family will be there. They'll be celebrating it as a ritual, but don't do it after birth. The baby is new to our environment. If you are bathing, the chances of So hypothermia is very, very high. If they're exposed to cold air, bathing and all these things should not be encouraged. Sponging, yes. After how many hours? 24 hours. Bathing, yes. After the umbilical cord falls off. Maybe 2 weeks it will take. A homeless man comes with diarrhea, dementia, dermatitis. Whenever you come across these three words, diarrhea, dementia, dermatitis, what should come to your mind? Yes, good. It is pellagra. Repeat the words properly. What it is? Pellagra. Yes. He was consuming alcohol occasionally. Yes. He was consuming alcohol occasionally. That is one more clue. So they just want to divert your attention. Yes, good. He admits to having X as a staple diet pattern. He was telling, sir, I was having this slightly cheaper, or so they used to give me, sir, because it is very cheap. It will cost around 1 rupees, 2 rupees. So they used to boil it, or they used to heat it in between, and whatever waste is left, they used to give it to me. I was staying here, or else I used to purchase it because I was very poor and I have only this much money. So every day I was having two. So one corn or one maize, indirectly I'm telling the answer, is costing 2-3 rupees. He'll be purchasing for 2-3 maizes and he was having his food. Everyone is having their own life. So ऊपर से जब आओगे नीचे तो फिर you will be feeling that everything will be same, but it is different. The scenario here, it is very different. The scenario after 1 year will be different. After 10 year will be different. सबका अलग अलग दुनिया होता है. हम लोग क्या सोचेंगे सबका दुनिया एक है. नहीं, दुनिया तो एक ही होगा, गोल गोल है ना, लेकिन जो रहने वाला है ना, उनका दुनिया अलग अलग होता है. उनका सोच अलग है, उनके पास जो पॉकेट अलग है, उनका जो भी एक्सेट्रा एक्सेट्रा सब अलग अलग होना चाहिए. दैट इज व्हाट लाइफ इज. देयर इज and hope that one day everything will be equal. That hope is there, that thing will be there and that stays with you forever, but life is totally different. Everyone is living their own life. That is why I'm telling, so don't compare with anyone. There will always be people better than you, always be people lesser than you. That is the rule of life. Good. So what is the answer? Maize. Maize is responsible for pellagra. Yes. What is the reason? Lack of tryptophan. You should be knowing biochemistry question. Tryptophan is converted to niacin. Repeat the words. Tryptophan is converted to niacin. So if there is niacin deficiency, there will be pellagra. Sir, maize देते बार बार. Yes, this question will be there. अगर maize नहीं है तो फिर क्या मार्क करना है? ज्वार. अगर maize option में नहीं है, then the answer should be ज्वार, sorghum. Jowar can also cause pellagra. Yes. What is the reason? Jowar is rich in leucine. Repeat the words with me. Jowar is rich in leucine. Excess of leucine will block the conversion. Excess of leucine will block the conversion from tryptophan to niacin. ये जो cycle है ना, वो block हो जाएगा बीच में. What is the reason? Jowar. Jowar is rich in what? Not lysine. It is leucine. एक बार थोड़ा सा tongue, leucine. Yes, very good. Excess of leucine, tryptophan to niacin pathway is blocked. Jowar. Maize nahi hai, then the answer will be jowar. In the motivation model of health education, there are 3 stages for adopting a new idea. If you want someone to practice anything, adopting new ideas means you want someone to, yes, good, do hand washing, for example. How to adopt that hand washing in that community? There is a sequence. First and foremost, you have to create awareness in the community. What is hand washing? What is the advantage? Why we have to do? See, if you are telling something, someone do this, they won't do. First you have to tell what is this. Awareness create होना चाहिए. Then you have to tell the advantages also. देखो बेटा, ये सब हैंड वॉशिंग करने का फायदा है आपको भी फायदा होगा, कम्युनिटी को भी फायदा है, लास्ट में गवर्नमेंट का भी टारगेट अचीव हो जाता है, सबका फायदा है. फायदा तो छोटी छोटी चीजों से शुरू हो जाता है. तो पहले इंडिविजुअल की बात आएगा, कम्युनिटी, इंडिया का मतलब पहले हर एक सिटीजन. यस, गुड. हेल्थ के लिए तो अवेयरनेस हैंड वॉशिंग का एग्जाम्पल दे सकते हैं. हैंड वॉशिंग का अवेयरनेस आपको क्रिएट करना चाहिए. आफ्टर दैट मोटिवेशन विल कम विद इन देम. उनको लगता है यार इतना एडवांटेजेस है हैंड वॉशिंग करने का ना, There are so many advantages of hand washing. I have to do hand washing. They will interest create हो जाता है यहाँ पे motivation phase में ना, interest भी create हो जाएगा, evaluation भी चलता है, interest and evaluation. Repeat two words, IE, interest and evaluate. Evaluate means they will think, okay, good, if I do this, what will be the advantage again? So they will be having interest, evaluate, and one phase will come where they will do the decision, where they will take their decision. Yes, वो जो फीलिंग आ जाता है ना यस, वो तो इसी फेज के अंदर है, मोटिवेशन के अंदर. जब यस का फीलिंग आते ही फिर आपको करना होगा बेटा, तो सुनो, यस तक पहुंच गया ना तो फिर करो ना, खत्म करो मैच, फिनिश द मैच. एक्शन, दैट इज द आंसर. तो रिफ्लेक्शन, कंटेम्पलेशन, डेडिकेशन ये सब कुछ नहीं होता, आंसर इज एक्शन. हाउ टू रिमेंबर? आमा. आमा मतलब अवेयरनेस, मोटिवेशन, एक्शन. रिपीट थ्री वर्ड्स. आमा, आंजी, मोटिवेशन मॉडल बोलते हैं, आप क्या बोलोगे? आमा. आमा का मतलब अवेयरनेस, मोटिवेशन एंड एक्शन, दैट इज अडॉप्शन. Unvaccinated 5-year-old child presents with sore throat and difficulty in swallowing. Okay. On examination, she is having a grayish white membrane. Diphtheria. Yes, good. Diphtheria. She has a fully vaccinated 2-year child who is the contact and is not having any symptom. तो केस को क्या करोगे आप? केस को तो एंटीबायोटिक स्टार्ट किया, एंटीटॉक्सिन देते हो, फिर जो केस है उसको आइसोलेशन में चलेगा. सो केस को आइसोलेट करोगे. सो केस को आइसोलेशन में रखोगे, दैट इज सिंपल. तो सेपरेट उसको आइसोलेशन में रख दिया. फिर बाद में क्या आता है? कॉन्टैक्ट को कैसे मैनेज करोगे? नाउ द न्यू गाइडलाइन सेज chemoprophylaxis irrespective of immunization status. Repeat with me, good. Chemoprophylaxis irrespective of immunization status. So she has been fully vaccinated, but still she has to take chemoprophylaxis. Either we give penicillin or erythromycin. Repeat, chemoprophylaxis के लिए क्या यूज करेंगे? Penicillin or erythromycin. Sir, if the question comes not vaccinated, फर्क नहीं पड़ेगा ना. Contacts, chemoprophylaxis irrespective of vaccination status. If the contact is not vaccinated, vaccinate. हाँ, good. Vaccination भी करोगे, chemoprophylaxis भी दोगे. अब already mentioned vaccinated. अब वैक्सीन की जरूरत नहीं है. So booster, single, ये सब जरूरत नहीं है. We have to give chemoprophylaxis irrespective of immunization status. Good. Disease has an incubation period of 3 to 14 days. Highlight this number. Maximum incubation period is 14 days. Good. It has a median incubation period of 10 days. That is to confuse you, they are giving in between. The person is traveling abroad but not taking vaccine. Okay, not vaccinated. As per the rules of international regulations, how long the person will be quarantined in the airport? Tell me the answer. Good. Tell me the answer. Quarantine means जो exposed individuals है, for example बिना वैक्सीन सर्टिफिकेट का वो आ गया हमारे पास. इंक्यूबेशन पीरियड कितना है डिसीज का? 3 to 14 days. मतलब आपको वेट कराना होगा उसको. We need to make him wait. Yes, good. Make him wait for how many days? Maximum incubation period. Don't mark double the incubation period. अगर डबल 28 days तक वेट कराओगे तो फिर आपका इंफ्रास्ट्रक्चर खत्म. जरूरत नहीं है. कितना वेट कराओगे? उसको भी वेट कराओगे, आप भी देखते रहोगे, कुछ हुआ करके 28 days तक अगर वेट कराओगे ना, तो इट इज द ब्लंडर ऑफ योर लाइफ व्हाट यू आर मेकिंग, एंड यू आर टॉर्चरिंग द इंडिविजुअल लाइक एनीथिंग. इट इज नॉट ट्वाइस द इंक्यूबेशन पीरियड. आंसर इज maximum incubation period. What is the answer? 14 days. Some students by mistake they mark twice the incubation period, and if everyone is marking correct and if you are marking wrong, just imagine the situation. Almost 90% of the students they marked it correctly. Some students they read some wrong information. अगर wrong पढ़ के फिर wrong मार्क करोगे, सब right मार्क करोगे, मतलब if everyone is marking right, सबका right हो गया फिर आपका गलत हो गया, तो it's very difficult then. It's very difficult that one question can take the whole exam from you. The image shown corresponds to which health education program and disease? So what is this? School bag is there. A girl. She is the mascot for leprosy campaign. Yes, what is that campaign called as? Sparsh campaign. Sparsh campaign के अंदर what we do, Sparsh, touch. So it is related to leprosy. Sparsh campaign के अंदर what is the main thing? Community के अंदर awareness create करना होगा. That is very very important. Leprosy patients, how they present, how they are treated, what is the transmission. So if they are treated, it is not that transmissible, so nothing to worry. So don't treat them as untouchable patients. Don't want stigma. All these are leprosy के अंदर जो campaign है ना, स्पर्श campaign का important objectives है. So स्पर्श campaign के अंदर who is the mascot? Cartoon character है. Who is the mascot? We cannot bring Virat Kohli, we cannot bring Dhoni. It will take so much of money from us. So the only thing is we will design a cartoon and we will give the name. So क्या नाम दिया था उसको? सपना. सपना to reduce stigma under स्पर्श campaign. Repeat 3 words. सपना, स्पर्श, stigma. सपना, स्पर्श, stigma. सपना, स्पर्श, stigma. Very 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 important. Leprosy program के अंदर सपना is to create awareness. It is a mascot used under स्पर्श campaign for which disease? Leprosy. आरोही, अमिता, गौरी, ये सब है ही नहीं, सिर्फ ऑप्शंस है. तो किसी का गर्लफ्रेंड हो सकती है, वो सब अलग बात है. सो गौरी, आरोही, यस, आई हैव सीन आरोही, यस, गुड. अमिता, लाइक दैट एग्जांपल आई एम टेलिंग. ए बी डी, गलत गलत गलत. आंसर इज सपना. सो सर, इज देयर एनीथिंग कॉल्ड एज आरोही? नो. अमिता? नो. गौरी? नो. गौरी गौरी? नो. यस, देयर इज nothing like that. Meena? Yes. Meena is for girl empowerment. Don't make one more blunder of your life. Some students will tell, sir, Meena is UNICEF mascot for leprosy. Galat hai. Meena is for UNICEF, yes, but it is not for leprosy. It is for girl empowerment. एक छोटी सी बच्ची होगी, उसके पीछे एक पैरेट. Yes, good. Meena is for girl empowerment. Sapna is for leprosy. A study is investigating the relationship between two things: diet consumption and incidence of a disease. For example, incidence of cancer. They are studying the association relationship. Among 100 vegetarians, 30 had the disease, and among 100 non-vegetarians, 50 were affected. If you are telling non-veg is related to cancer, you are doing a case control study. Repeat, non-veg is related to cancer, you are doing a case control study. Or you can do the study like this: exposed, non-exposed. Good. How many are exposed? 100 vegetarians. Non-exposed, 100 non-vegetarians. So if you take non-veg as exposed, then 100 non-veg will become exposed individual. They are having chicken. So they are exposed to chicken, for example, red meat, for example. 100 exposed to red meat. Remaining 100 vegetarians means they are not exposed to red meat. What statistical method is used to check if there is any significant association between diet and disease incidence? Whenever the word association comes, you should not mark correlation coefficient. ज़्यादातर बच्चे ना will mark correlation coefficient. Correlation coefficient association के लिए नहीं होता है. What is association? Diet yes no, incidence yes no, दोनों yes no होता है ना. That is association. Exposed yes no. Disease yes no. If I'm studying yes no, it is not correlation. Correlation is between two quantitative variable. Height weight का क्या relationship है? Age और blood pressure का क्या relationship है? That is correlation. But if they ask association, your answer should be chi-square test is the most commonly used test to check significance of association. सर ये वाला क्वेश्चन आएगा एग्जाम के अंदर. yes, chi-square test is used to check the significance of association. Which of the following options, yes, good, which of the following options will correctly represent the sequence of demographic cycle? This option was mentioned as correct in some books, but that is wrong. So obviously that can't be the answer. Answer has to be option B. Some books they are giving this as the answer, but that is completely wrong. So what is the answer? High stationary stage. It will start from there. Good. Birth rate, death rate equal. Birth rate, death rate equal. That is where everything starts. Then comes early expanding stage. Death rate will come down, birth rate no change. Repeat. Death rate will come down, birth rate no change. Population will start expanding. Later, birth rate also starts coming down. I have shown the demographic cycle in the previous questions. Birth rate will also start coming down because of family planning program. Just a birth rate will also come down, death is also coming down. There is a gap always, demographic gap is there, population will increase in this stage also. Then low stationary. Both will come equal and it will become low stationary stage. Later, birth rate will become less than death rate. People will die more because of higher life expectancy in that population. Death rate ज़्यादा हो गया. So population will start declining. Compared to birth, if death rate is more, growth rate is negative. In what stage? Declining stage. Growth rate is positive. In what stage? Early expanding, late expanding. Means population is increasing. Repeat, stage 1, high stationary. 2, 3, expansion. How we call it as? Early expanding stage, late expanding stage. 4, low stationary stage. What is 5? Declining stage. So how many stages we have in demographic cycle? Total 5 stages. Can you tell in sequence? 1, high stationary, long back, before independence. Then death will come down, early expanding. Birth will also start coming down, late expanding. Low stationary stage. Then comes declining stage. A man presents with sudden onset bilateral leg swelling, okay. Diarrhea and difficulty in breathing, good. He reports consuming mustard oil purchased from a local vendor. Yes, good. Highlight this word mustard. That is the clue in the question. Pedal edema is the clue. Bilateral pedal edema, leg swelling, pedal edema. Health inspector is investigating the condition. So usually what will happen? Health and food inspectors both will come. So you'll be complaining to the food inspectors. You'll be suspecting something wrong in the shops. That local vendor is selling something. What is that selling? Mustard oil. So this is epidemic dropsy. Drops, oil, yaad rakhne ke liye I'm telling, oil. So mustard oil, what they are doing? They are adding argemone to mustard. Repeat my words. What they are doing? They are adding argemone oil to mustard oil. So what is the adulterant they are adding? If this is my question, what is the adulterant they are adding? Argemone. Argemone is the adulterant. They are adding to what? Mustard oil. What will happen because of sanguinary toxin? Repeat the words. What is the toxin? Sanguinary toxin. वो जो toxin की वजह से what will happen? Pedal edema. Sometimes glaucoma also. Cardiac failure is very much common. That is why you might be having difficulty in breathing now. Cardiac failures is very much common. If they ask this question, what they will do now? They will go to the shop. They will take this sample of mustard oil. They will bring the mustard oil. They will add the reagent. Most commonly used test is nitric acid test. Repeat the words. What is most commonly used test I am asking? Nitric acid test. But if they ask what is most sensitive test? The most sensitive test to detect argemone, your answer should be paper chromatography test. पहले नाइट्रिक एसिड टेस्ट किया आपने, वहां पे कुछ मिला नहीं, आपको कुछ कलर चेंज नहीं है, ऐसे नाइट्रिक एसिड ऐड करोगे ऑरेंज कलर आना चाहिए, वो तो है ही नहीं. फिर भी आपको सस्पेक्ट है कि वेंडर कुछ ना कुछ कर रहा है. बेटा देखो सुनो, कुछ ना कुछ तो है इसके अंदर, दया कुछ तो कुछ गड़बड़ है. बेटा देखो करो कुछ. क्या करेगा वो? पेपर क्रोमेटोग्राफी टेस्ट. मोस्ट सेंसिटिव टेस्ट. P for pedal edema. Repeat my words properly. P for pedal edema. P for paper chromatography test, which is the most sensitive test to detect argemone. अगर पूछेंगे, answer is paper chromatography test. In a population of 30,000, in a population of how much? 30,000. 500 live births. So repeat with me, how many live births are there? This is the question. How many live births are there? Yes, good. 500 live births. So 14 stillbirths are also given. So that is just to misguide you. Stillbirth has no role now. It is always live birth you have to use. So stillbirth has nothing to do with any of the thing. Just take live births. How many live births are there? Repeat with me. How many live births are there? 500 live births. So use that information. Use that information now. What the extra thing they are giving? There were 18 children. Repeat the words. There were 18 children. Yes, good. Correct. 18 children dying before 1 year, that is infant deaths. 12 died before 28 days, that is neonatal deaths. In that, 9 died in the first 7 days of life. Highlight this word. First 7 days, it is early neonate. So they are asking you to calculate early neonatal mortality rate. What is the formula? How many early neonatal deaths? Answer, repeat, 9. What is the denominator? Live births. 500 live births. If I am telling for 500 live births, 9 will die. For 1000 live births, how many will die? If you multiply with 1000, you will get the answer, but still directly answer I am telling. For 500, 9 will die. For 1000, how many will die? What is your answer? Double. Answer is 18. Very easy question. 37-year-old woman from Bihar. So answer is here only Bihar. Fever, weight loss. There will be anemia. Yes, good. Here, यहाँ पे देखो anemia. Splenomegaly. Yes, good. 3 things are clearly mentioned. Repeat the words. Fever, anemia, hepatosplenomegaly. यहाँ पे only splenomegaly is there. That is fine. Well and good. So spleen is involved. Yes, good. Fever, anemia, splenomegaly. It is a triad of which disease? Kala-azar. So fever, anemia, hepatosplenomegaly, it is the triad of Kala-azar. So the question is, what is the vector responsible for Kala-azar? Okay. वही लिंक है, सेम लिंक है. ठीक. So this question, what we are discussing then. A 37-year-old from Bihar. I told the 3 keywords for you. Repeat, what are the 3 keywords? Fever, anemia, hepatosplenomegaly. Good. Fever, anemia, hepatosplenomegaly. So the patient was having Kala-azar. So for Kala-azar, what is the vector? For Kala-azar, what is the vector? Answer is sandfly, phlebotomous. So for phlebotomous, the scientific name is Phlebotomous argentifex. Yes, sandfly, the scientific name is Phlebotomous argentifex. And for sandfly, always we use synthetic pyrethroids. We don't use DDT sprays now. We are using synthetic pyrethroids. So what is the vector? Repeat, sandfly. What is the insecticide of choice? Synthetic pyrethroids. पहले क्या use करते थे हम लोग? DDT. Before we used to have DDT. Now we are not using DDT. We are using synthetic pyrethroids. If they mention what is the insecticide used? Synthetic pyrethroids. Next question. An hospital is collecting nasopharyngeal swabs from 1000 patients every day for the onset of disease. The organism count was found to be maximum on 5th day. So the patient also showed maximum infectivity on that day. So what is this gap from the onset of disease? So this gap from the exposure to maximum infectivity. Repeat the words. So this gap from exposure to maximum infectivity is called as generation time. So don't make mistake. Exposure to high infectivity is called as generation time. Exposure to 50% of the cases, that is called as median incubation period. This question is not on median incubation period. This question is on generation time. So exposure to maximum infectivity. What is serial interval? What is serial interval? Serial interval is between 2 things. Primary case, secondary case. The gap between primary case and secondary case is serial interval. Which of the following is not included under school health program of Ayushman Bharat? So health screening we do, yes, for mainly anemia, refractive errors. Deworming for school children we use albendazole. Sanitary napkins for adolescent girls, it's a part of that, yes. But monthly iron folic acid, it is wrong. So it is not monthly iron folic acid tablets. It is weekly once. What is that full form? WIFS. Weekly once iron folic acid supplementation. We don't have monthly AFA tablets in school health now. It is weekly once. In a village, it was observed that several farmers had this crossed gait and they used sticks for support. So 1 stick, 2 stick. So crawlers they will need later. This is Neurolathyrism. Neurolathyrism, the diet was consuming certain pulses. What was that pulse called as? Kesar dal. Repeat the word. Lathyrus sativus, Kesar dal. So if you are consuming such a pulse, Kesar dal or Lathyrus sativus, what vitamin has to be taken for prophylaxis? If they mention, your answer should be vitamin C prophylaxis. We advise steeping, parboiling, fine, but the toxin which is responsible is BOA. If the toxin is beta oxalyl aminoalanine, what is the toxin called as? BOA. Beta oxalyl aminoalanine. If this toxin is responsible for neurolathyrism, the prophylactically we have to use vitamin C. So vitamin C prophylaxis is used to prevent neurolathyrism. Again, 35-year-old with history of cough, weight loss, both sputum smears turned out to be negative. X-ray had some lesions of tuberculosis. So this is the older question. The question has been repeated in the exam. What is the next line of investigation? We have to do CBNAT. So any patient, like if he is having symptoms of tuberculosis, sputum examination has to be done, chest X-ray has to be taken, but now we are not doing sputum chest X-ray. Directly we go for CBNAT. What was the old algorithm? Sputum positive start treatment, but sputum negative X-ray positive do CBNAT. That was the old question. Sputum positive होते फिर treatment चालू करो. But sputum negative X-ray positive, then we used to have CBNAT. This was the answer. But now if they ask what is the first line of investigation, any TB suspect, we have to do directly CBNAT. Research is being conducted to find the association between aniline exposure and bladder cancer. The study was done in the factory workers who worked in the factory for more than 20 years. Good. 2 groups were formed. One involved in dye handling, means they are exposed. The other were office workers who are not exposed. Years of occupation and their outcome was noted using records. So it's a record based study. Answer is retrospective cohort study. It will help in saving time and cost. So it is not case control, it is cohort only, because they are framing 2 groups. Exposed group, non-exposed group. Then they are checking what is the outcome. That is blood cancer or bladder cancer. They are going from exposure to outcome. They are going from exposure to outcome in a forward direction, but with the help of records. So it's a record-based study, that is cohort study. The BP of a population was tracked from childhood to adulthood. It was observed that those who had lower BP in childhood will have low BP, and those who are having higher BP in childhood, when they become adult, they will be hypertensive patient. This phenomenon is called as tracking of blood pressure. Means blood pressure tracks in the same way. High BP will become high. That is why school children, we have to screen for BP and take necessary precautions. Rule of Hall's is different, like 50% only diagnosed. Within 50% diagnosed, 50 are treated. Within those who are treated, 50 will have suppression of BP under control. If they ask 50, only 50 are diagnosed, 50 are treated, and 50 are having their BP under control. If these words comes, then your answer should be rule of 50%. Here it is not 50%. Here it is tracking of blood pressure. What is STEPS approach related to? To assess risk factors for non-communicable disease. To assess risk factors, there is a protocol. Step 1, questionnaire we study. Step 2, physical measurements. Step 3, biochemical measurements. How many steps are there to assess risk factors for non-communicable disease? 1, 2, 3. Step 1 is questionnaire. Step 2, physical measurements. Step 3 is, yes, good. What is step 3? Biochemical measurement. Out of 100 women in the study, for 2 years, 10 become pregnant. So what is the denominator? Women in the study. How many women into months? Means time. Multiply with 1200. If you are taking women in the denominator, we have to multiply with 1200. If they ask what is the multiplier? 1200. But what is the numerator? Accidental pregnancy is 20. So, यहाँ पे 10 है ना? Okay, accidental pregnancies is 10. Numerator is 10. Now tell how many women are there in the study? 100. Yes. How many years of contraceptive or months? If they ask 24 months. If I am asking 24 months, then 1s are 2s are, yes, good. Numerator is 10. Answer is 5 per 100 women years. What they are telling? 100 women into 2 years. Repeat the words with me. 100 women in the study, 2 years of contraceptive. It will become 200. For 200, if 10 will become pregnant, for 100, how many will become pregnant? Answer is 5. For 200 women years, it is 10. For 100 women years, it is 5. What is this index? What they are calculating? Pearl index. Pearl index is used to calculate what? Failure rate of a contraceptive. What is the denominator? Women in the study. One more thing, how many months they are using contraceptive? What is the multiplier? 1200. What is the numerator? How many accidental pregnancies? Which of the following is most common disease after a disaster? Any disaster, it can be flood, earthquake, etc., etc. The most important or the most common disease will be gastroenteritis. There will be loose stools, there will be vomiting, so it is gastroenteritis. So vomiting is very common, loose stools is very much common. So what you are supposed to do, the most effective prophylactic measure, if this question comes, the most effective prophylactic measure for preventing gastroenteritis, your answer should be health education. Yes, good. Health education for what? Safe water and sanitation. Repeat the words with me. Health education for safe water and sanitation. We don't advise mass vaccination for cholera, typhoid and all. Mass vaccination not necessary. Cholera, typhoid, vaccines no need to invest money. Just go for health education. Safe water and sanitation. A population study is showing a mean glucose of 86. This is the mean value, 86. Total sample 100. That is the sample size. The glucose shows normal distribution. Yes. What is the rule of normal distribution? It is bilaterally symmetrical curve. 50% will have values less than mean. 50% will have value more than mean. What is the mean value? 86. How many are above this? This is the question. Answer is 50%. Out of 100, 50 will have mean glucose more than 86 and 50 will have value less than this. FMGE screening exams, we ask basic questions on normal distribution. You should know this. Calculate risk ratio. Yes. What study? Cohort study. So risk ratio is also called as relative risk. Repeat the words. What is one more name for risk ratio? Relative risk. Relative risk is calculated from what study? Cohort study. What is the formula? Risk divided by risk. Because it is ratio, na? We have to divide two things. What you are dividing? Incidence in exposed divided by incidence in non-exposed. Very easy question. 30 by 5 is the answer. Incidence in exposed divided by incidence in non-exposed. Just they are asking whether you know the formula for risk ratio or not. Answer is 6. The patient is having fever for 1 week, loss of appetite, he was not responding to any other drugs, antibiotics, antimalarials. So typhoid viral test is negative, but RK39 is positive. So I'm putting one more question on Kala-azar because it is very, very important. RK39 results are positive, it will indicate the disease is Kala-azar. This will show antibodies against K39 antigen. If the patient is having antibodies against K39 antigen, he is having infection in his blood. That infection is called as Kala-azar. Kala-azar ka treatment is liposomal amphotericin B. K for Kala-azar, next alphabet is L. It is liposomal amphotericin B. Infusion we have to do. So what infusions they are advising? Repeat the words. What infusion? Liposomal amphotericin B. Single dose infusion into the blood. If they ask what is the oral treatment for Kala-azar, agar orally agar lena chahoge, matlab what tablets the patient has to get orally, it is miltefosine. The patient is asking, sir, I don't want infusion, I don't want IV drug, give me something oral. Yes, good, give me something oral. Agar oral drugs agar puchenge na, then your answer should be miltefosine. Here it is not oral, they are asking what is the drug of choice. 1,000 patients in the study were screened for disease with new test. The test is showing positive in 90 patients out of 100 who are actually having disease. So how many are disease total? 100. 90 are detected by your test. This is true positives. So 90 by 100 is sensitivity of this test. So sensitivity is 80%, 90%. So 90 by 100, what is sensitivity? Answer is 90%. If they ask define sensitivity, sensitivity is ability of a test to detect true positives. So out of 100, 90 are detected correctly. So sensitivity is 90%. A patient with lymphatic filariasis is being managed as shown in the image. This is what level of prevention? This is after complications. This is not management. This is after complications. You are promoting the quality of life. The patient is already having disability. She is having that disability. She cannot move her feet. She is having ulcers, etc., etc. Just cleaning the wound. This is called as disability limitation. Yes. Take care of ulcers. Take care of secondary lesions in that area. That is called as tertiary levels of prevention. That is disability limitation. A 45-year-old woman from Assam presented with fever and chills. What is Assam? Northeast. Yes, that is why they are giving Assam, Northeast state. On examination, she was conscious but febrile. Peripheral smear shows these lesions. These are banana-shaped gametocyte. Repeat the words. These are banana-shaped gametocyte. It is an infection that is very much common in India, but fatality is also very high. It is falciparum. Falciparum in northeast states, you have to use ACT, artemether plus lumefantrine. So what is the ACT combination used in northeast states? Artemether, lumefantrine. If I change the question, 45-year-old woman from Delhi, then your answer will be option B. ACT used in other states, it is artesunate sulfadoxine pyrimethamine. But ACT used in northeast states is artemether lumefantrine. Falciparum, we use ACT for 3 days. Repeat the words. ACT for 3 days. But primaquine 1 dose. Primaquine 1 dose on second day. Usually we use primaquine 1 dose, not 14 days. Primaquine 14 days is for Vivax. But primaquine 1 dose is for falciparum. What is this plot? What you are seeing? It is Box-whisker plot. So there will be a box in the center. This is median. So this is first quartile, second quartile, third quartile. Repeat, how many quartiles are there? Q1, Q2, Q3. So there will be whiskers on either side. There will be whisker 1 and whisker 2. So box in the center representing quartiles Q1, Q2, Q3. This is minimum value, this is maximum value. So when you are arranging the data in ascending order, when you are arranging the data in ascending order, this is minimum value Q1 first quartile, Q2 second quartile, and Q3 is third quartile, and there is maximum value. So Q1 or Q3 का जो distance है ना, if I plot this distance, this is interquartile range. What is this distance between Q1 and Q3 called as? First quartile और third quartile के बीच में जो distance है, that is interquartile range. So this is box, this is whisker. Box whisker plots they are showing. Option B is the answer. While conducting a demographic study, you need to calculate total dependency ratio. Yes, good. Numerator is dependents. So that is what the question is. Who are dependents based on the age? Population less than 15 years. That will be engaged population. Population more than 65 years. That will be old aged population. So engaged plus old age अगर numerator में आ गया, so remaining all the other individuals will be in the denominator. 15 to 65, that will be in the denominator. Numerator is dependents, denominator is remaining other population. That is why it is ratio. So what is the formula for total dependency ratio? Numerator they are asking. Numerator we have to keep dependents. Numerator we have to keep dependents. Yes, good. So this was the session for you. So I have tried to cover all the important PYQs, as many PYQs which I can cover in the time which was adding the keywords, how to rule out the options, how to take care of the time in the exams, how to get the correct answers. So I'm giving one basic idea for you in this session. So any doubt, you can use my Instagram handle and you can use my name. It is given there in the discussion part, Dr. Rajeev Shetty. So you can follow me on Instagram. Yes, any doubt, you can text me in that. So all the best. Again, don't panic in the exam, nothing to lose. So if you go in a free mind, if you go in a calm mind, it is very easy. Don't take too much pressure on yourself. This time I have to clear, this time I have to clear. Not like that. Just try to do the process properly. Routine is very, very important. Try to read as much as possible. Try to give more time for retaining things. And at the end of the day, try to recall whatever you have read. Keep 1 hour for recalling at the end of the day. So this is how most of the students will clear their screening exams. I hope everyone in this session will clear this along with your friends who are not there in the session also. All the best for everyone. Any doubt, Insta me in the Instagram, Rajeev Shetty. Dr. Rajeev Shetty is good. All the best. Again, thank you so much. Best wishes for everyone. Good. Thank you so much.